I'm going to direct the first question to Ruth, which seems so appropriate given your experience, Ruth, and that generally speaking, what makes a city or community age-friendly? And in talking about that, perhaps you can say a little bit about New York City's age-friendly initiative.
I think the core characteristic of an age-friendly community is one that treats the expertise and experience and perspective of older adults as central to what it's doing. I don't think that anybody else can walk our paths and speak on behalf of us as effectively as we speak ourselves. So that's the centerpiece. The second, the surrounding piece to me is to recognize that what an age-friendly community means is that the whole community works for older adults to do whatever it is that they want to do. It's not a matter of having enough aging services or enough painting services or enough any kind of services. It's a matter of having a city that works for people of all ages. And the only way to know the ways that it isn't working for people of all ages is to consult with people and learn from them how the things that they used to love to do, they're now impeded from doing, and then to problem solve creatively in communities about how those barriers can be broken down.
Great. And New York City clearly has been engaged in quite a bit of work in that regard in recent years that I know you've been centrally involved in.
Right. New York City has been engaged in that work. We did consultations with older adults around the city. In truth, the very first of those was at the center. Chris Quinn was there. I was there. You had a staff member there. You were somewhere more important, I'm sure. But
Pfizer.
Probably. And I didn't know what was going to happen because it was really the first time that we'd done this. And the first thing that happened was the room was way too small. Cyril, were you there? I can't remember. So the room was way too small, right? And it was some crazy room. It had a piano in it, and it had a weird sort of lift in it, and there were people hanging off the rafters. So the first thing that we learned right away, and we learned it over and over and over again, was that there was this huge appetite to tell my life and tell my story and talk about what's important to me, not from this sort of deficit, tell me what you need model, but from this opportunity, tell me what you want model. And it started right there at the center, and it's kept ongoing. We've talked to thousands of older adults. We've done so in only 6 languages, which, of course, in New York is a shanda. It's way under doing that. We've done so in American Sign Language. We've done it in low vision contexts. We've tried very hard to think about inclusivity, but you never think enough about that. And then we've responded. We've leveraged both public and private resources and public and private creativity to try to solve some of the problems identified, address some of the, the problems that people stated. I'll give just one sort of seemingly trivial example, but people said that one of the things that impeded their independence was the fact that the city, some 30 years ago or so, took out every bench in town. There were a set of concerns. And as a result, it makes it harder to go about your daily life, do your shopping, take care of all your needs and issues, which everybody really wants to be able to do for themselves, when there's nowhere to just take a break. And it helped us to realize that benches are part of the sort of physical fitness and activity and independence landscape in the city. Department of Transportation identified some federal money that they could repurpose to do these benches. They held a design contest to make the benches kind of wonderful. And those very, I think, good-looking, styling, Italian-looking silver benches that are turning up around town are built through that initiative. But one last piece of it. But where should we put them? There's a consultative participatory planning process of where to put the benches, where older adults are able to say, people are able to say, where it would be great to have a bench. And if the specs work out okay for the city to put a bench there, and the block agrees, then the bench goes in the spot where people said it would be a good idea to have a bench. And they're being well used and well appreciated, and it's sort of a little vignette. They'll come out over the course of the afternoon.
Great. So Maya, Ruth's discussion seems like a great opening to hear some perspective from you on how do we take this concept of age-friendly communities and think about it in the context of LGBT older adults. And I think, as Ruth put it really nicely, not only from a need perspective, but also from a perspective of the great resources that LGBT older folks offer for not only for the LGBT community, but more broadly. So we'd love to hear from your experience in Portland, some initial thoughts on that.
Well, I loved Ruth's explanation of age-friendly cities, and I think that that's something that Portland has really worked hard on. And, beyond just creating spaces for older adults, it's about really getting community buy-in to embrace them as meaningful contributors to the community. And then for us, I think it's been our desire and mission to figure out where LGBT older adults fit into that, and that it's not just about creating spaces for them specifically, it's about giving them a role in the community and having an opportunity to have their voices, their needs, their wants, their preferences heard. And I think in our community, that's very much started with physical environment. We're a city that loves our parks, our trees, our green spaces, and then also bricks and mortar, our buildings, are they accessible? And then that's all sort of really basic stuff. But then moving towards the message of that, are these really healthy, safe, accessible environments for the entire community? And how do we make those healthy, safe, accessible environments for the LGBT community? For us, it's been around, going back to brick and mortar. What do we have on our walls? What is our message conveying by the artwork that we post or the photos that we put in our brochures? Are we inclusive of all of the communities that we serve, and with this special emphasis? Do people recognize themselves in our services? One of the things that's unique about Friendly House, where we're housed, is that Friendly House is a community center intended for everybody in the community. We are not a specific LGBT community center, and so early on in our planning, when we started talking about how we were going to develop this program, it was brought up to us that having a mainstream community center that was inclusive of families and older adults and young people, that it offered some anonymity to our LGBT older adults that they didn't have in traditional LGBT community centers, so they sort of outed themselves by walking in the door. And that's gone both ways. I think there is a balance between anonymity and solidarity. But we have made a really concerted effort at having materials that represent who our population is, having artwork, making sure that our policies and practices reflect the inclusiveness that we'd like to see the rest of the community embrace. One of the big successes that I feel that we've had is around our training component. And we have trained facilitators and an elder panel that go out to businesses and schools and have had a tremendous impact with those people. Last year we trained over 900 individuals, and it's helping them be visible in a way, and in a way that they haven't been for a long time. I think by and large Portland is a pretty progressive and an open community. I think mostly people want to know what the issues are and what the strengths are, and the challenge is you don't have to step too far out of Portland to see different practices. And so we have started sort of in our core and begin to branch out a little bit. Sorry, I just lost my train of thought.
No problem.
Go ahead.
No, I said no problem. We can come back to you and pick you up in a couple of minutes, because something that you mentioned made me think about a question I think is really a good one for John. I mean, Maya was talking about the role that community centers can play, right? There are many different sectors that can make contributions to helping to support and build age-friendly communities. I mean, you come to us today, John, with your wearing the hat of private philanthropy, and I'm curious to hear from you about what do you see as some of the special or particular contributions that private philanthropy can make in terms of helping to support this concept of age-friendly communities?
Well, first to say it's great to be here. As an older gay man myself, it's obviously an issue of particular importance to me personally as well as professionally. We've had a lot of opportunities to work with communities around the United States. We're working with the Pfizer Foundation now in 5 communities fairly intensively, trying to work with each of them to make their community better. But as Ruth so eloquently put it, you got to start where you start. A lot of people have said, well, what's your model? So you develop a model, then you go to a city and you say, here's our model, do this model. And Ruth will tell you how successful that is, especially in rambunctious New York City senior centers. So the important thing is you start not only in a community setting with whatever the strengths of the community are and the needs as they're expressed in the community are, but also at the very local neighborhood setting as well. And that's where, Harvey Milk told us a long time ago that the one thing that we all had to do was be out. And it wasn't easy then, and it's not easy now. But if our voices aren't heard, then who's going to know what the needs of LGBT seniors are? And so it's really important at both the local level as well as the national level to continue to reinforce that there are needs that are different, there are needs that are the same, there are strengths that are the same, and there are strengths that are different. And so we have to incorporate all those pieces and start where we are and move it forward.
Great. Ruth, it's interesting, comments from both Maya and John, that there have been, I think, some themes coming about listening to voices and hearing voices. And, Maya talked about some of the work with business and schools. As a member of the New York City Age-Friendly Commission, one of the things that I've been really impressed by is the array of stakeholders that have been brought into this process. And of course, I know that you have done work in a number of other cities that are driving their own age-friendly processes. I'm wondering if you could say a little more just about the breadth of stakeholders that have been engaged, because I think it's a really important message about what we're talking about and how integrated this approach is.
Yeah. I do think that one of the sort of deep differences about this age-friendly model from other alternative models is that it recognizes that what we're promoting is an age in everything lens. And so the idea is do whatever you do with an eye to how is this benefiting from and of benefit to older adults as it is to others in the life course. And we look in doing that for stakeholders for whom this is a new kind of win-win-win situation. So let me pull the idea of business out, because I think there's a couple of examples that you can use there, and that we have used. So you don't necessarily think about businesses and aging in the same breath unless you do. But the ways that businesses and older adults interact that we've been thinking about and trying to facilitate, not just thinking about, but trying to make happen in a better way, is, first of all, older people are a customer base. This is sort of the simplest level. The silver economy, as they're calling it, I think more and more in Europe, is not just about luxury cruises. It is about the bodega on the corner. It is about the grocery store. It is about the pharmacy. It's about the hardware store. And it's about all of the stations that you need in order to have your normal daily life's needs met. And what old people told us around the city is businesses can either be part of the problem or they can be part of the solution. So it can either be a horrible sort of indignity and difficulty to go to the, neighborhood businesses, or you can feel known, welcomed, cared for, connected, be able to hang out, be able to sort of see your friends. To me, the sort of best case scenario is there's a chair, you have a glass of water, a couple of other people are there too, and it's literally becomes one of those places where you can watch the world go by, participate in the world go by, and the age-friendly local business initiative is part of helping businesses to recognize this is a valued customer base, make them feel welcome, and they'll be loyal to you. We promoted that around the city. We've got 1,000 businesses enrolled, which, as you know, you New Yorkers, that's a drop in the bucket. But then in order to try to spread the word further, we said, well, what's in it for businesses? I think they might like to make more money, especially this has been a pretty tough time. And we evaluated whether age-friendly businesses or their non-age-friendly counterparts were actually taking in more cash receipts over a period of time, and discovered that the age-friendly businesses were. It was a small study, but it was going in the right direction, and it was hopeful. I'm not going to talk for the rest of the afternoon, but let me just say another important way, a thing that businesses are, which is employers. And one of the big issues for people, as everybody in this room knows, is the desire to stay active in all the facets of life that are meaningful. For many people, that includes work. People want to work, people need to work, and too often, employers are less interested in having their older employees stay in the workplace than people are interested in staying. We created, with the support of the Alfred P. Sloan Foundation, a new initiative to give awards to employers in the New York City area that value and take action to facilitate the sort of continued constructive engagement of their older workforce. It's called Age Smart Employer. Look for it. We did research and identified those policies and practices that were useful both from the point of view of the business and from the point of view of the employer, and that maximizes the strengths of older workers at the same time that it meets the productivity objective of the workplace. We think that at this point we need carrots in addition to sticks. We need to reward people for good behavior.
I'm so glad you mentioned that that employer awards program. Certainly, in our experience at SAGE, some of you know that we have a program at SAGE called SAGE Works, which is precisely focused on this question of supporting older members of our community so that they can remain engaged in the workplace. It's very important. Maya, I want to turn back to you. I mean, the work of Friendly House and the work that you've done on behalf of LGBT older adults through SAGE Metro Portland, it's kind of a jewel. And when we think about LGBT aging work across the country, there are so many different programs. I think of the Gay and Gray Expo, etc. Can you say a little more about what are some of the really interesting and innovative ways that you're engaging in finding that your LGBT constituents are responding to in your programs and in building an age-friendly community there?
I got to say, Michael, that it has been so exciting to be a part of this. Our program's been around for 12 years, and I've been a part of it for the last 9. And I would say that early on, it was a little bit like Sisyphus, that there were a lot of people putting in a lot of energy, and we'd get courtesy meetings, but this last 3 to 4 years, I think Portland is really taking hold of this issue in really meaningful ways, and not just Portland, but our state as well has been really supportive. And frankly, Multnomah County Aging and Disability Services has been an amazing partner with us. Some of the things that have happened really just very recently in the last couple of years is that our own county made a financial commitment to this program. And we now have a 5-year contract to provide services, not only case management and in-home services, also recreation and volunteer opportunities for LGBT older adults. And the money initially had been earmarked for racial and ethnic minorities through the Older Americans Act. And I know you guys have done terrific work at trying to get the feds to expand their definition of vulnerable older adults. And our county has actually gone ahead with that. And so through some advocacy on our part and really good partnerships, the county, instead of just focusing on racial and ethnic minorities, was willing to broaden the criteria to include cultural minorities, which is how we secured this 5-year contract, which, again, is our first real stable funding. As a result, we're able to work a lot more closely with partners and other stakeholders. And our incredible program coordinator, Lauren, developed a curriculum in partnership with the state to train all of the home care workers across our state on the specific strengths and challenges of the LGBT community. So even in places like Pendleton or Ontario, not to pick anybody out, but places that are slower to come to the table, their home care workers are being trained in how to work more culturally competent with this population, because we know they're there too. Additionally, we've been doing trainings with the adult care home people, which has been a challenging group at times. They have been somewhat resistant to taking in LGBT older adults, but we're seeing that just shift momentously over the last couple of years, and it's been extraordinary. AARP has been a really good partner and with us, at virtually every step. And then back to the expo, which is, I think, where your question started, and I took it in another direction. But that was really our first attempt at engaging business in this project. The annual expo is a resource fair, sort of. We have businesses who come in, businesses who are committed to serving LGBT older adults respectfully and competently. We do breakout sessions on topics ranging from sex over 60 to spirituality. But last year we implemented we made the training mandatory. So not only are the businesses investing by paying to be a part of it, they are receiving a condensed version of our training. And we expected that there might be some resistance, and the feedback from it has been phenomenal. So those are just a few of the ways that business and government have really grabbed a hold of this issue. And our state also is doing very targeted outreach to the LGBT population for their long-term planning with regard to long-term care. So something has shifted in the last 4 or 5 years, and it's been extraordinary to be a part of it.
That's great. That's great. You know, some of what Maya was observing makes me think about resources and resource allocation. You know, Maya was talking about the work with SAGE and others have been doing around the Older Americans Act to try to attract more federal support for efforts to make sure that communities are inclusive of LGBT older adults. We know that this is a national movement for age-friendly cities. It's an international movement, and at the end of the day, change happens on the ground in our community. So, John, I'm curious to hear from you if you can offer us some observations about, given that there is so much to be done at the national level, at the local level, and that we live in a time of limited resources. How do we as a community, as those of us in philanthropy, as advocates, members of the business sector, how do we think about resource allocation and the many kind of competing needs for that as we work to build age-friendly communities together?
I don't think you do think about it. And I mean by that it's what I often hear from people in philanthropy, particularly local philanthropists, is aging is a very difficult conversation to have because it's overwhelming, it's depressing. We don't know what to do. What has our little foundation got to offer? These are things I hear all the time, and I think you hear the same thing from local businesses and other kinds of groups. So I think if you think about aging, the whole comprehensive everything, or even LGBT aging, it becomes a very difficult conversation. Which is why I think the age-friendly communities movement has actually been so successful, is because what that allows you to do is start wherever you are. So if you're a philanthropist that works on affordable housing, lots to do on affordable housing for the LGBT population, for aging population in general. If you do nutrition programs, if you do community gardens, if you do almost anything, it can fit into this umbrella. So it allows people to sort of see themselves where they already are and move out from there. We need to help them move out from there. But I think the problem is that it often is just so overwhelming for funders in general. And I think the other thing that's compelling about the age-friendly city and community aspect is that there's just no more money. And so if we don't figure out how to work together more effectively, we're not going to get this job done, because there's not going to be another Older Americans Act that's going to dump hundreds of billions of dollars into the system, which was what we would have to be able to meet the needs if we did it the way that we've been doing it before.
Ruth.
Just to expand on that, I think the idea that for governments, that they think in terms of the whole life course, all their populations, including the older adults, in all their resource allocation decisions, so that we're not getting the funding for old people from the tiny bit that the Department for the Aging Services has. We will never get there from there. But instead, we are assured that in the capital allocation budget, we think in terms of every time we replace a bus shelter, we replace that sort of stand-up cave with one with a bench and one with glass sides, so you're not sitting in there like a sitting duck. that every time, we go and look at a street, we take a complete streets mentality to it, and we think about it from the point of view of pedestrians, from the point of view of bicyclists, and from the point of view of drivers, lastly. That we think about intersections from the point of view of everybody who needs to get across them should be able to get across them. And so when they get redesigned, or when they are particularly dysfunctional, we're reorienting them in that way. And that is not just true of the built environment. It's true of the service environment and the service sector also. That what we have to do is think about how to make the resources of the city work for everybody, not to try to capture a larger and larger share of a shrinking pot of resources.
Well, and it's interesting because in a sense, this program, this town hall here, this space that we have to have this conversation in, emerges from another way of thinking, I think, holistically and creatively. This is a result of Pfizer's great work and Pfizer's partnership with SAGE, and Pfizer has partnered with numerous other organizations as well. So this is symbolic of our efforts to really bring in the entire breadth of the community into this work.